Hey guys, this is Dr. Sean over at Fortis, and we're in week 2 of medical terminology. So I'm looking at the screen right here, and I just want to go over some quick stuff. I've done a couple other videos, and I know they're huge, like 20 minutes. Let's do this one in about 5 minutes, okay? So I'm going to go through and just do kind of a quick rundown of everything in here. We have the week overview. As you can see, you can't really see my cursor, unfortunately, can we? Yeah, there we go. There's my cursor. And we can see exploring medical terminology of skin and bones, right? So the musculoskeletal and integumentary. Learning outcomes. Let's check the learning outcomes here and see what we want to get into and want to understand with this kind of stuff. So, identify terminology or organs related to dermatology, the study of the skin. Employ medical terminology with bones and orthopedics. Orthopedics is the treatment of joint and bone diseases. Okay, apply medical terminology to the functions and structure of muscular system. Very easy. Translate medical terms into everyday language. That's kind of our big deal on this one, isn't it? So let's go through and see what we got. The what do we have? The expectations. We got all that. Everybody knows everything's due by what? Initial post for discussions is due Wednesday. That's tomorrow, whatever day it is. Wednesday at like midnight. I'll check them after that. I really don't add any details to it, but I might send you a little note with it that says, hey, good start, let's go and do a little bit more. Okay, and then make sure you do your 2 discussions, and I've said this a million trillion times, but when you do your discussion responses, they have to expand on the information. Okay, and I can tell when you guys are just cut and paste. It's pretty obvious. So we don't really get grade off for that, but you know, it's something. Let's look at. What is this? The book. You can look at the book if you like. Don't forget to get the book in real life. I think it's a good idea. It's talked about all of the bones. There we have in the middle of this part here. We have the axial skeleton and the appendicular skeleton. Anterior and posterior view. Those posterior and anterior views and stuff like that are really important to get, because I think those help you identify where things are in the body and also discuss that with others. So if I say something is a left lower quadrant or right lower quadrant of the abdomen, you know exactly where it is. Or if I say there's a fracture in the or blunt force trauma in the left humerus proximal to the whatever you say, right? We can go into kind of those. Then it goes all this other stuff right to the integumentary system. And this one here, I love this little picture. You can't really see it too well on there, can you? But this little picture in here is the 3 layers. That's the epidermis, the dermis, and the hypodermis. I did a whole bunch on that video too. So don't be shy about that. Here's the what is this? Healthcare communication information down at the bottom of the page. Let's see, we'll go up like this. There we go, week 2, medical terms, translations. And let's see, knowledge check. Oh, here's our first knowledge check. The word osteo. Os means actually whole, but osteo means bone. So we'll hit bone here and see what happens. Bing, bong, boom. There we go, instructions, knowledge check. It just wants to see what you can do. I should go back on that one. Let's go back real quick and do something real fun with it. I'm going to go through and look. Muscular, okay, this would be muscular, nail would be unco, and skin would be integumentary, right? This changes it up, you can see right there. Let's go here. This is discussion. So look at the discussion already. I want to show you something. Diagnostic tests and requests. Okay, so you work in a multi-specialty practice where you and another person are responsible for scheduling necessary diagnostic tests and surgical procedures for the patients. You're preparing to send diagnostic testing requests to the hospital, and you notice that your coworker has written a diagnosis of a fractured clavicle. Fracture and broken are the same thing, right? On a request for an x-ray of the small intestine. Small intestine's down here in the abdomen, so you're probably not going to find a clavicle in there unless they ate somebody else. A fractured clavicle, broken bone. So now we go down here, we can see all of these, and you see little dots next to them. You can even see little people's names, but let's not worry about those too much. Go down to my name here. But we can see, look at how much this one person put in here. That's quite a bit. That's good. Good at what a fractured clavicle is. Really good, what's this called? We got the references down on the bottom. Very nice, okay? Doesn't have to be quite this much. This is really a wonderful example of a very good and detailed discussion. Mine is a little bit smaller, obviously, and that's what I'd like to see is just a little bit, abbreviated, not too much, not too small. Notice the thread here. We have this, and then we have somebody else who, what's it called? They responded to it. Really good, really good. Look. I want to say something here for Kristen, who did a great job on this one. Monica, you went to a great deal of detail with all 3 points and made it very clear to understand. I like that. Good. That's the same thing as saying I agree, but this is a little bit more. It's personable. I like that. I agree that sending the test request written would be misdiagnosis and wrong treatment. Blah, 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 blah. There you go. You're explaining it exactly how you're supposed to. So if we go in through here, and can we go through the rubric? We'd have to go do the grades. Anyway, I'd have to do the grades and stuff like that. But anyway, that's all I wanted to talk about for this one, just 5 minutes. Get your stuff done on this. Let's go to the next part real quick. We'll do another 1 minute, make a 7-minute video. The assignment. I think I did go through the assignment on this one too. If, again, you guys are needing anything, please let me know. And we'll talk to you guys very soon. I'm going to go through and do another video on week 2. This is just a week 2 updated version of everything else. Talk to you later. Bye.